Hello, my name is Nigel Gooding and I'm the chair of the Neonatal and Paediatric Pharmacist Group, NPPG. In 2018, NPPG produced a position statement in conjunction with the Royal College of Paediatrics and Child Health around the standardised use of concentrations of liquid medicines in children. The position statement was produced to address concerns which had been reported in practice, where children were prescribed a concentration of liquid which was subsequently changed, usually in a different healthcare setting, to a different concentration. If parents and carers were unaware of this change in concentration, they would continue to administer the same volume of medicine, unwittingly administering a completely different dose to that intended, with potentially serious consequences. In order to reduce the variation in liquid concentrations of medicines prescribed, the position statement recommends a single concentration of each medication based on the principle of a dose volume not being less than 0.2 mL or more than 10 mL to administer the dose, thus covering a range of patients from neonates to adults. The position statement focused on unlicensed liquid medicines, as this is where the most variation in concentrations is seen. However, in the future, the position statement will also include licensed liquid medicines for where a range of concentrations are used and expand the list of unlicensed specials. The B&F for children have also included the recommended concentrations within the relevant drug monographs. Many hospitals have now reviewed these concentrations of medicines that they prescribe to come in line with the recommended concentrations. However, there is still some variation of practice in primary care. This dashboard has been designed to help identify primary care organisations which are still prescribing non-standard concentrations of these medicines and allow PCN pharmacists and prescribing advisors to work towards correcting this position. The dashboard will also provide an update each month to help demonstrate improvements in the prescribing of standard concentrations of liquid medicines. I'd now like to hand over to one of the trainers who will take you through the dashboard and how it works.
Hello, and welcome to this demonstration of the Children's Standard Liquid Concentration Dashboard. To select the dashboard, simply click the link. Once the dashboard link has been selected, as you can see, this will default to the national page of this dashboard. We also have other pages allowing you to break your data down depending on the organisational level that you work for. We have a regional page, a sub-ICB location page, a PCN page, and a practice page. This will allow you to break the data down dependent on the organisation that you work for. For today's demonstration, we're going to remain in the practice page. Once we've selected our main page, we then have the option to select practice items to see the standard strength and non-standard strength items being prescribed and dispensed to patients of a particular practice. We also have the option to look at the net ingredient cost of those standard strength and non-standard strength items that have been prescribed and dispensed by this practice. And as well, we have the practice net ingredient cost per list size page, which will look at the net ingredient cost of standard strength and non-standard strength items per 1,000 patients. For today's demonstration, we're going to remain in the practice items page. Once we've selected the level that we want to break the data down at, and the sub-page we want to view, in this case the practice items page, we then have underneath our criteria selection. This will allow us to view the organisation we wish to view, as well as choosing all of the other criteria available for selection. We can select a particular sub-location. We can then select a particular practice out of that sub-location. We also have the ability to look at patients collectively, adults and under 18s. But we can also, if we wish to, select just to see the under 18s or just to see the adults if we do wish. Now for today's demonstration, I'm going to select just the patients that are under 18 years of age. We next have a month selector. Now the data within this dashboard is being produced on a 12-month rolling, which means the month selected will show 12 months of data, with the month selected being the last month of those 12 months. And we also have the list of chemical substances that are being presented as standard or non-standard liquid concentration items, as we can see. Available to select. Once we've made all our selections for the criteria, we'll then make sure we click the apply button, just so it returns the data that we want to see. Now we've selected our criteria, what we can see is, for the particular practice that we've chosen, we can identify with the performance tiles. There were 6 standard strength items prescribed and dispensed to 1 patient within that 12-month rolling period. There were also 2 non-standard strength items prescribed and dispensed to 1 non-standard strength patient, and in total 8 items collectively over that 12-month rolling period. Underneath the performance tile figures, we have a comparison view comparing the percentage of standard strength items prescribed and dispensed for each of the practices residing within the sublocation that we've selected. We can also switch from this comparison view to the table view and see those tables of figures for each of those practices. Underneath the comparison view, we also have a trend over time analysis, which will allow us to look at trend values, such as the standard strength items being prescribed and dispensed across the period of time shown within the trend analysis view, as well as the non-standard strength items being prescribed and dispensed over the period of time detailed within the view. As well as being able to see the trend for items, we can also see the trend as a percentage for the percentage of standard items being prescribed and dispensed across the practice in the time period selected. Now, the benefits of this dashboard are to see that variation in prescribing for standard and non-standard liquid concentration items, to detect any trends in that prescribing using the trend analysis graphs. But also a benefit of the dashboard is to actually be able to identify these non-standard strength patients receiving these non-standard strength liquid concentration. To be able to do this, in this case, we've identified 1 patient. If we want to find out who that patient is, we can do that by coming to the Supporting Information tab, then selecting the Patient Details sub-tab, and contained within here is the request procedure in order to find out who that patient was. Now, this is a purely external procedure. We're not permitted to put patient details within the system itself. So if a user would like to find out who that patient was, just follow each of the steps of the request procedure. The requester must come from the particular practice that that patient has been prescribed from, filling in all the relevant information and sending that off to the ePACT2 support team. Once the team has all that information, they'll then send that over to the analyst, who will generate the NHS number or numbers of those patients you wish to identify, and they'll externally email back out those numbers in order for you to perhaps review the medication of that patient and see if we can move them over to some more standard strength liquid concentration items. Thank you again for attending this demonstration of the Children's Standard Liquid Concentrations dashboard.